to news this morning at 8:01. Chances are someone in your office maybe has called out sick and will soon.
Yeah, for sure. The Department of Health Services confirms the flu is now spreading across Arizona. 3,700 cases documented so far.
And that is just the people who went to the doctor, not the ones who, suffered through it at home. Yeah. Mark is out at Arrowhead Health this morning. Mark, how's it going? Are you thinking about that flu shot?
I am leaning towards it, especially after speaking to Dr. Johnston out here. You start leaning towards it and wondering it's probably a good idea, especially, again, keep in mind, we've got quite a few more months left in this flu season. So if you did come in, though, you'd actually come through here. You'd check in right here. We just want to give you a little tour of Arrowhead here for a sec. This is where you'd come in through. You'd check. And then you'd come down this hallway right here and come into one of these exam rooms or waiting rooms right here, and you could get your shot in here as well as get checked up if you already have the flu, because as we'll talk about in a minute, it's important not to get that shot if you have any flu-like symptoms. But here's Dr. Johnston out here joining us again this morning. First of all, when it comes to the flu, talking about signs and symptoms, how do you know? And a lot of people wonder, hey, how do you know if you have the flu or if you've got something else? Sometimes it's tough to tell.
Yeah, so the symptoms come on very, very suddenly. Usually fevers, chills, headache, body aches, that's a really bbig one, and then a cough. So sometimes people associate stomach kind of stuff with the flu, but that's usually a different type of virus. Okay,
so when it comes to getting the flu shot this late in the season, we're now in February. A lot of people have already got it. We're talking October, November, in the fall when it's obviously a good time to promote it so it lasts the entire season. But it's still important to get, with months and months to go. Talk a little bit about that.
Yeah, so generally we start our flu campaigns of giving vaccines in the fall because usually the flu will hit around Christmas time. This is a little bit later in the season, so it's not too late. It takes about a couple of weeks to start getting that immunity up after a flu shot. And it's just hit now, and we do expect the flu to continue for the next couple of months probably.
When it comes to treating this, I know there's a lot. Obviously, everybody recommends staying home if you have the flu, getting lots of rest. Are there any other big things from a doctor's perspective that you would recommend doing if you do have it?
Yeah, so if you do recognize the symptoms early, there is treatment that you can take. So there are antiviral type of medications. Tamiflu would be a good example of that. And if you can get on the medication within the first 24 to 48 hours, it will actually lessen the severity and the length of how long that you'll be sick. So that's really important. And then also to keep in mind that when you get the flu, sometimes you'll get a secondary infection on top of it. So people, especially if they're maybe a little bit older or they have a secondary medical problem like asthma or COPD or diabetes, something like that, they can get pneumonia. So if you're not getting better from having the flu, it's definitely a good idea to get checked out by your doctor.
Perfect. Dr. Johnston, thank you so much. A fellow Canadian, by the way, as we discovered between live shots. So I was excited to hear about that. It's always nice to promote my fellow Canadians. Of course, though, if you do have the flu, if you want to get a flu shot, you can get that at any pharmacy. And if you have the flu, you can also come in here to Arrowhead Health Center and get it treated. They're open Monday to Friday, 7 to 7, and on Saturday from 8 till 1 o'clock.
All right, Mark, thank you.